Good afternoon, everybody. Welcome to this Greater Manchester press briefing, the first for a while. We've got a briefing of two halves for you today. The first is on matters related to the pandemic, so I'll be joined by Baroness Beverly Hughes for that. We'll take you through the latest data and then open up to your questions. That'll take us till about 2:45. And then at that point, I'll invite City Mayor of Salford, Paul Dennett, and Councillor Elise Wilson, Leader of Stockport Council, to join us for a discussion on the Greater Manchester Spatial Framework, which was this morning cleared by leaders unanimously and will now proceed to a final public consultation. So we will move on at that point to the Greater Manchester Spatial Framework. But if I may begin with the latest data, it's a challenging picture in Greater Manchester, as it is across the rest of the country. So we've got 5 slides to take you through. The first is on the case rate per 100,000 population. So you can see there that the headline rate on the top line has increased quite significantly over the last couple of weeks, concerning figures for a number of boroughs in the 600s, a number of our boroughs now. Perhaps slightly more positively, on the very latest data related to the 25th of October, the final column, that data reflects a slight reduction in Manchester, Rochdale, Salford and Trafford compared to earlier in the week, but we wouldn't want to read too much into that. These figures are high. And of course, a matter of concern for us, and you can see the growth, the trend growth across the month laid out in the table. If I turn to the second table today, this is a new one, but we thought this might be useful for you to put what you've just heard into context, because of course it was the case going back a couple of months ago that very much we were seeing higher figures here almost in isolation from other parts of the country, and we still have higher levels than other parts of the country. But we thought it might help just to compare the Greater Manchester growth rate in cases in the last 2 weeks to other regions, just to get that wider context. And so what you have here is a range of figures that are a very wide range, actually. If you go from the northeast at 4% right up to the West Midlands at 77%, you can see that the way in which the spread of the virus is changing now across the country. So in terms of the table that you saw at the beginning, to kind of contextualize that, the growth you saw there, 43% growth, is a little higher than the England average. But not much outside of the England average. And of course, what we're now beginning to see is a higher growth rate in areas in the Midlands and the south of the country. So a really changing picture out there, and a picture that's changed a lot since the last time we gave this briefing to you. If I might move on to testing. I won't dwell on this slide for a long time. But this table shows you how testing has continued to increase across our 10 boroughs, and actually stands at the highest level yet, at an average of 3,022 tests, pillar 2 tests per 100,000 population, and a high positivity rate across the board. So again, which will give us cause for concern as we head into this difficult time of the year. So that's the latest position on testing and the positivity rate. The next slide is about care homes, and obviously this is an issue that we've been tracking very closely. As you will know, we've given you this figure for a couple of months now, watching any effect of a second wave on care homes, and it was pretty constant through August and September at 0.5, 0.6% of care home residents showing symptoms of COVID, and began to increase a little as we went into October, as you can see, to the point now where it's 2.5% of care home residents in Greater Manchester confirmed or showing symptoms of COVID-19. Now, Of course, that is a matter for concern, but I think it is important to compare the situation that we have now to the one that we went through earlier in the year. Indeed, the country went through with regard to cases in care homes. So although the only comparable figure we've got for the earlier part of the year is a figure from the early part of May, the 5th of May, because it took time, as you know, for the testing to take place in care homes. The figure then for the 5th of May was 6.7%. And the peak of some of the problems in care homes came in April. So I think for comparison purposes, just to give you a sense of the different position that our care homes are in, again, no complacency, but it isn't the same as we were seeing last year. And we are watching this incredibly closely and dealing with it very, very directly. So on to the final slide, if I may. And this is an important slide. And again, this reveals quite a significant change, and again, something that we watch closely and is a cause of concern, a significant cause of concern. If you look at the weekly admissions on the top line, you will see that they have fluctuated, but are trending up to the 67 admissions between the 19th of October and the 26th for the week ending, the week that's just ended. Below that is a figure that is the one that I think is the one that is responsible for the majority of cases. This is people who are not admitted with COVID, but are diagnosed after they have been admitted. So obviously they could be feeling very ill as a result of COVID, or perhaps linked to another underlying condition. But what you can see there is that there is quite a significant increase in the number of inpatient diagnoses for COVID-19. They will be the vast majority people who are coming into hospital, possibly as an emergency patient, who then subsequently on being admitted are tested and diagnosed, having not been diagnosed in the community. But perhaps also some hospital acquired COVID, which is an issue that we would want to, again, keep the closest of eyes on. If I could turn to the the figures below, which relate to bed occupancy, been very much in the news. So again, you will see there a change over the week, a significant change, where the number of patients in high dependency or intensive care beds has increased by 38 over the week, from 62 to 100. If I can put a little bit of context on that figure, that represents an 83.2% of capacity. So it is obviously getting higher and increasing, but that is not necessarily unusual for this time of year. Although, of course, what is unusual is the sure fact that there are more people to be coming in the coming weeks, given that we haven't reached the peak of this second wave. So it's high, but is not still unusually high for this time of year. And also, it's really important to say that the capacity is not fixed. We have the ability to, and we will add extra capacity to HDU and intensive care to be able to manage and cope with the situation that we face. So actually, in the last couple of days, the figure has come down slightly, but still, the trend is clearly upwards. Overall, 829 people in general hospital beds with a diagnosis of COVID-19. So again, increasing, and the hospital system is clearly under increasing pressure. And we are working closely with colleagues in the NHS to manage that. And as you know, the Nightingale facility, having been remobilised, will help with this situation. So I'm going to leave it there for now, and I'm now going to invite Baroness Beverly Hughes to give you an update on the latest position with regard to enforcement, particularly as we've entered Tier 3. Bev.
Thank you, Andy. Yes, as you know, Tier 3 commenced here in Greater Manchester, the very high alert level restrictions at midnight on Friday. So this last weekend was the first weekend when those restrictions were in place. We had officers dedicated to responding to COVID incidents and reports on all of the 10 districts, dedicated teams, and they were working closely with local authority enforcement officers throughout the whole weekend. It was actually a very busy weekend. There were 157 fixed penalty notices issued. There were over 1,000 actually licensed premises were visited by those joint teams to check on compliance. The calls in to the police were very high. So there were 519 COVID-related incidents reported into the police. There were 373 house parties or other outdoor gatherings also reported. So, you know, I think that shows, it indicates that on the one hand, a very high level of public concern about witnessing events that they feel are contravening the restrictions, but also as well, unfortunately, a very high level of activity in terms of house parties and gatherings that were not complying with the restrictions that we are now under. And just to give you an idea, some of those incidents included a very big party at an Airbnb premises in the city centre. The organiser of that illegal event was given a £10,000 fixed penalty notice. There was a wedding involving 30 people in Hyde. Again, more fixed penalty notices issued there. A city centre bar was fined £1,000 for carrying on serving after 10 o'clock. And a number of other, you know, very kind of similar events that accounted for those fixed penalty notices throughout the weekend. The police's approach continues to be to explain to people, first of all, and you know, try and get them to understand what they need to do and why, but moving much more quickly now to enforcement where it's obvious that there's a clear breach of the restrictions going on. General policing is back at business as usual level, so really high demand on domestic abuse and other forms of crime as well. Both the police and the fire service continue to help with the tracing work that's going on in Greater Manchester, and I think doing a really good job and making a difference. That's only kind of you know, if the national tracing system was better, if we got better data from that system and we got it more quickly, then they'd be able to do even more. But they are making a difference to the level of tracing that's going on here in Greater Manchester. And then the last point really is just to say, I think I've raised with you before that one of the asks we've been making of government for some time now is to have stronger enforcement powers in terms of closing businesses that are not compliant. It takes a very long time now using health and safety and other legislation that wasn't designed for a health epidemic. We've been told that those regulations will be going through the Houses of Parliament next week, so we hope to be able to implement those in the weeks beyond that. Thanks, Andy, that's it from me.
Andy, you're on mute.
Thanks, Ross. Thanks very much indeed, Bev. And that last point you made is really good news. That's the summary closure powers that Greater Manchester has been calling for some time. So if they do go through Parliament next week, we believe we'll be able to significantly improve our enforcement activity, particularly against those business premises that aren't operating safe COVID practices. And it's not just pubs and restaurants, it's shops and supermarkets that we would hope that those powers would cover. If I could just finish on one point around the 1GM campaign, which we launched earlier this week. What we are trying to do is obviously bring together as much support as we can for people and businesses who are going to be affected by the Tier 3 situation and the closures. So there broadly are three strands to what we're building here through the 1GM initiative, and it's wonderful actually to see all walks of life in Greater Manchester rallying round and contributing to this campaign. The core of it, of course, is the public support, and leaders and I and the Deputy Mayor have discussed this issue this morning. We will be in a position to say more next week. The first announcement we'll be able to make about the support that will be available to particularly businesses that have been closed as a result of the Tier 3 restrictions. So we should be in a position to say more next week. So people might want to look out for that. Of course, the public money, as people know, won't be enough, and I need to manage people's expectations. We haven't got enough to do everything that we think is needed to be done, and that was clear, and that's why we had such a public disagreement with the government. Tier 3 is going to damage our economy very seriously, and yet I don't think it's going to deliver the benefits in controlling the virus that are claimed. So this is a challenging situation for us, and we do have to be honest about those expectations. However, I am very grateful to the Greater Manchester business community who've stepped forward to say they may be able to do more to help outside of the scheme of public support that we've been working to set up, and that's a positive. And then, of course, the Greater Manchester Mayor's charity also stepped forward, raising funds voluntarily, and again that should provide a safety net for people who perhaps may not be able to get what they need from the schemes that are being put forward with the government funding. So thanks to everybody who's come forward to support 1GM. This is a campaign that will build over the winter, and it's going to be much needed. But I just would want to, through our colleagues in the media, put the appeal out for people and businesses across Greater Manchester to kind of come together through this single approach and do everything we can to maximise support for people and businesses who are going to be most affected this winter. So Ross, I'm going to leave it there and get into colleagues' questions, and we've got the best part of 25 minutes for those. Over to you, Ross.
Thanks, Andy. I'm going to take two questions about Christmas. The first one's from Helen Pidd at The Guardian. Andy, do you think a national lockdown could save Christmas? I mean, there's a better chance of us being able to meet with family from other households indoors on the 25th of December. And Katie Hazeldine at That's Manchester asks, Andy, as you know, many people are anxious as we get closer to Christmas and are currently in Tier 3. Just a simple, do you have a message for these people in our region that will be worrying with all the uncertainty around the Christmas and winter months and missing out on those precious family times?
Well, thanks, Helen. Thanks, Katie. Helen, in answer to your question, the answer is yes, to a degree. I think saving Christmas might be the wrong way of putting it, because it's going to be different this year, and I think everybody has to get used to that idea. Sadly, it can't be what we would normally expect to do. But I do think if we were to approach a national circuit break in the right way at the right time, it could allow families more contact over the Christmas period than might otherwise be the case, particularly if we ask families to perhaps manage their own isolation arrangements running up to Christmas, so that perhaps two households could bubble together in that period, knowing that that they were all safe to do so. So I think there are arrangements that could be put in place to give people some form of Christmas. And I think the government needs to turn its attention to this rather than sort of digging in behind a regional lockdown strategy, which personally I don't believe is going to work in terms of reversing the growth in the cases that we've described today. I think it would be better to turn attention to the potential of a national intervention, which would then give people the hope of a better Christmas. And I would encourage the government to not dig in behind its current strategy, but be open-minded about other alternatives that might be better for our economy, have greater health benefit, but also then give people the hope of a better Christmas than they may otherwise be able to have. So that would be my message then, Katie, to your question, that, you know, I know people are worrying about lots of things at the moment. They're worrying about their jobs, they're worrying about the money situation, they are probably pretty low, they're worrying about relatives who perhaps they've not seen, who are in care homes. You know, there's people worrying about so many things right now. And I think we need to be in a position where we can offer people more certainty, more hope. I don't believe that the regional lockdown strategy is going to give people that hope or that certainty. And it's why I would just reiterate what I've just said in answer to Helen's question. I think it is incumbent on all of us to come back together, to look at the situation that we're in as a country and see what we can do to carry people through. Of course, we're looking across the Channel and we're seeing more decisive action being taken in France, in Germany. All I would say is we can't rule anything out at this stage, and I don't think the government should be doing that. Let's kind of get a strategy together that has maximum benefit in bringing down the cases, creates the least damage possible to our economy, and gives people hope of something of a Christmas with families together. So I think we do need to be working together on a more hopeful message for people, Katie, because I know people aren't feeling much hope right now.
Thanks, Andy. Just staying on the subject of national lockdown, Harry Pete at ITV National News asks, Andy, is a national lockdown the only way forward? And do you agree with Lancashire's Public Health Director that the North West has been put in a Tier 3 system that doesn't work, while we wait for London's infection rates to catch up with the North, which would then be seen to warrant a national lockdown?
Well, Harry, I have a great deal of sympathy with your question and the way that you've put it. In discussions with the government, and particularly when Greater Manchester's leaders and myself and the Deputy Mayor had the chance to discuss things, particularly with the Deputy Chief Medical Officer, we were told that a national lockdown was certain to work, whereas a regional approach may not work, and there was no guarantee about it. So, faced with that, I mean, nobody wants any form of lockdown, do they? I mean, no one wants to lock things down unnecessarily. But if given the choice, I would prefer a shorter, sharper national intervention as opposed to a winter in Tier 3 that could become more and more difficult. And that's why I say I hope the government won't dig in here, because the damage is being done now. Greater Manchester has been in Tier 3 for a week. Already we'll have people today who are struggling badly as a result of this because of the loss of earnings, the worries that they have about that, business owners worrying about the future, survival of their businesses. This has real human consequences and it has health impacts as well as economic impacts. So my fear always with this strategy, Harry, was that we would go into a Tier 3 approach that wouldn't in the end work, but there'd be a lot of damage done to the places who were the first entrants into that Tier 3, the canaries in the coal mine, I think, as I called them a couple of weeks ago. And I still remain worried that that is what could well happen, that eventually we will end up in a national lockdown, but it will be with large parts of the north of England in a very damaged position going into that national lockdown. So this is the point that we're at, and I think the quicker that there is some honesty about the point that we are at, the better able we will be as a country to make the right decisions ahead of the winter period. And the point I would make about this is particularly thinking about the NHS and the figures I gave you before. If we have experts saying one route is certain to bring the cases down and another route is not certain to bring the cases down, I mean, really, what's the responsible path to take in those circumstances? And I think we all have to think about January in the National Health Service, traditionally the most difficult time of the year, certainly the first 2 or 3 weeks of January. Excuse me, we need to be thinking now about how we do everything we possibly can to relieve the pressure on the NHS during that time, because they've had a tough year already as it is. We have a flu season about to really kick in, and then all of the other pressures that are on the NHS, given that there isn't just a COVID only approach happening at the moment. There are obviously normal procedures and operations taking place as well. So it all needs to be looked at together. And I do have a lot of sympathy with Lancashire's Director of Public Health, who is saying that there isn't equal treatment here. We saw that the issue of the costs of Tier 2 were addressed when London went into Tier 2. And I think we might see the same if London goes into Tier 3. I don't wish it on them, of course I don't. And I know people in London need the support as much as we do. But I think there'll be a different approach to both the costs and the alternatives to Tier 3 if the capital city goes into tier 3. That is part of what we're saying at the moment. We can't have a country that's run in this way anymore. We need a country that's run equally and fairly for everywhere, and we don't have that at the moment.
Thanks, Andy. I'm going to put a question to Bev from Victoria Glover, Hits Radio. Bev, for the first section, with Halloween this weekend, how will that add extra pressure onto GMP officers, being that house parties have already posed a problem over the last few months? Are extra resources being deployed? Also, we've heard this week about some forces will go about policing Christmas. What's your take on policing the festive period, and how proactive will officers be in breaking up family events? Can we really be expected to sacrifice Christmas celebrations if tier 3 is still in place?
Thank you, Victoria. Well, to take the first part of the question, Halloween and also Bonfire Night, which is coming up not long after Halloween, it will put extra pressure on the police and also the fire service, and that has to be taken account of. So there's very careful assessment actually every weekend of the likely resources that will be needed. I think I've said a number of times on these conferences that overtime has been deployed, rest days have been cancelled in order to make sure that the police and the fire service in relation to Bonfire Night have got the people in place to provide the, not just the enforcement, but the safety of people. So we'll do that again this weekend, and there will be extra people deployed, as we've had to do most weekends actually since April. So an assessment will be made in the way that we always do. On policing, I think Andy's made relevant points here which on Christmas, which I won't repeat. I just say though that over the last few months we've had a number of very significant festivals amongst other communities, the Jewish community, the Muslim community, and again there's an experienced approach to that, which involves talking to faith leaders and trying to get the message out during this period around not having the usual kind of festive events. Clearly, Christmas is much more significant in that there's a lot more people expecting to celebrate Christmas than those other festivities, but the approach will be the same. I don't think the police will want to be proactive at all in breaking up family events, and we'll have to have, I think, a strong communication campaign in the way that Andy describes. It depends where we are then. If the rate of infection is still raging, then clearly there will have to be a strong approach to enforcement. But the police always want to police by consent. They don't.
They want to work with the public in having the right approach and making sure everybody's safe, and that's the approach that they'll bring to Christmas. But it depends what it's like when we get there.
Thanks, Bev. I'm going to take a question from David Collins to you first, and then I'll put it to Andy. David Collins at the Sunday Times asks, how do the number of fines being issued in GM compare with the number of fines being issued in April? Is there the same approach being carried out to enforcement as we saw during national lockdown? And are you noticing any differences in compliance from the general public compared with national lockdown in April? So Bev, put that to you first, and then we'll bring in Andy.
The number of fines being issued now is more tan April. I think when this all first started, everybody was quite cautious about fines, wanting to try and as I said before, work with the public, and so really going to enforcement as a last resort. And as I made clear at the outset, now with the current situation, where there's clear breaches of the restrictions, officers are moving to enforcement much more rapidly. I think there are differences in compliance from the general public now. I think at the start of lockdown, lots of people were very concerned, almost afraid. There was a sense of being, in a situation which was unpredictable, and that made people very, very careful. I think there's two factors that have changed that. One is that I think, and officers are finding this, that there is actually, despite the fact that we're in tier 3, there's a lot of confusion about what that means and what the restrictions are. And that kind of tends to lead to a kind of looser compliance, I think. And also, there isn't that same fear factor, certainly amongst younger people. You know, they see people are getting COVID, and at the moment, they're not dying. But, you know, we're concerned because we see these rates rising. There's evidence underneath the top line figures that the infection is reaching people in the older age groups, over 65. And so we are concerned, obviously, if this rate continues. And we have to get that message across because it actually really is important if we're going to contain this and hopefully suppress it and do the things that people want to do, like be able to have some kind of Christmas with the family, then it's really important that we get the message across now about compliance.
I'll bring in Andy on that question as well.
Just to add, Bev set it out very clearly, David, but just to add, in terms of the same approach to enforcement, well, we're about to step up enforcement if we get the powers through Parliament next week. So we've long believed there is a need for a tougher, more targeted form of enforcement against premises causing the most risk, and you know, we will step up enforcement if those powers come through. On differences in compliance, I think there is a degree of fatigue. Obviously, that comes with us being in restrictions for the length of time that we've been in. But I just want to take this opportunity to say again to people, particularly with Halloween coming tomorrow, bonfire night, you know, just to say to people, you know, we are in a challenging position. You've seen it with the figures with the National Health Service today. So the NHS frontline in Greater Manchester is under increasing strain, no doubt about it. The best way we can help them is to follow the regulations, the public health advice as closely as we possibly can. And you know, I would just make that appeal again to people, no matter how much we may have felt that some of what's been done in recent times is wrong. We still must follow those regulations, get the cases down as quickly as we can, and obviously relieve the pressure on the NHS. So I think we will see a step up in compliance coming soon. There is a general issue around, you know, fatigue, as I say, but I ask people to put that behind them, redouble their efforts, and of course, colleagues have raised issues around Christmas today. The more that we follow the regulations now, the more we might be in a position to allow people family time at Christmas. So I think all of those things need to be in people's minds as we go forward now into the most difficult time of the year.
Thanks, Andy. Two questions of a similar vein from Jen Williams at the MEN. You've said a couple of times that you're confident the hospital system can cope this winter. Do you mean cope with COVID patients or cope with both COVID and normal activity? Because some hospitals are already cancelling electives. And then The Independent has just published a story about a leaked report that shows we're about to run out of ICU capacity. So extra makeshift ICU wards are being set up in our hospitals. If this is happening now before November, how are we going to get through the winter?
Okay. So I'm just looking for your question, Jen.
So the first one's at 1:22 and the second one's at 1:31 p.m.
Okay. Sorry, I can't. Oh, the one. Yeah, sorry, I've got it now. Thanks very much, Jen. So it's a different position in the NHS to the one we had earlier this year, where obviously the NHS is doing more what you might call more routine activity alongside treating COVID patients, whereas earlier in this year that wasn't the case. But no, there is a good degree of confidence within the system that though it will be tough, there is enough capacity within the system and the ability to flex that capacity, increase it to be able to cope. And that's certainly the view that I've had from the NHS this week, that while it is expected to be tough, particularly in the next 2 weeks, that there is enough capacity to cope. And always at this time of year, increasingly as we go into the winter, perhaps earlier this year than normal because of the situation that we're in, you do see the cancellation of elective activity, unfortunately. I think you've reported on that. It's begun to happen in a couple of locations this week, but there isn't widespread cancellation at this moment in time. And obviously it's something we'll seek to minimise as we go forward. So it's not an unusual thing. It does happen in the NHS in most winters, but obviously it might be exacerbated this year, but we would want to keep as much elective activity going as possible. As for the report in the Independent, well, I don't want to kind of try and just dismiss something I haven't read, although I would treat that with a significant amount of caution, because I've just shown you the picture with regard to ICU capacity, 100 patients in HDU or ICU across Greater Manchester, which is a significant increase, no doubt about that, but it is 83% of capacity. So therefore there is headroom in the system, and that capacity isn't fixed. We can increase that capacity. Indeed, there is a plan to do so. So I wouldn't want to, I don't think at this moment in time, kind of going on speculative reports, leaked reports, is actually the best way to go. I think we should look at the figures, listen to what the colleagues in the NHS are saying, which they think we are in a position to be able to meet the demand that's coming. There's always the mutual aid opportunity that comes by working with other neighbouring regions. We don't think we will need to use that at this moment in time, although that could change. So there's no complacency here at all. It's a very challenging situation. We feel for our colleagues in the NHS, but I think it's very important that people keep things in perspective. And I think talking of makeshift ICU wards, I don't think is giving an accurate portrayal of the current position in Greater Manchester's NHS.
Thanks, Andy. If you're okay, I'm going to take a question from Tim Scott at Granada Reports, then Joshie Herman at the Mill, and then I'll put the question from Charlotte at the MEN to Bev before we move on to the GMSF section. So Tim Scott at Granada Reports asks at 1:37, Andy, are you calling for a national circuit break every time you speak to central government? And Joshie Herman at the Mill asks, at the beginning of this month, an internal health service warning was leaked predicting that COVID hospital admissions in Greater Manchester would reach 238 per day by the end of October. Now we're at the end of October and admissions are less than 10 per day. What has GM done right to achieve these very low admission levels? Should the public take credit for that, or the health system? And are there learnings here for the rest of the country as their cases rise?
Okay, thanks for those questions. So Tim, first on yours. I mean, I did make this point to the government, and also in terms of the media interviews I did at the time. I say again, I don't think the regional lockdown approach will work. It might dampen the number of cases, as we've seen when local restrictions came in here. I don't think it will turn them around and bring them right back down. The experts told us that only a national intervention of a circuit break kind would actually do that. So I do make that point to the government. I think the current approach risks maximum damage to the economy without achieving the health results that we need with regard to control of the virus. I think a national circuit break of the kind that we've seen in other countries, including now in Wales, presents kind of less pain for much more gain potentially. And I just hope the government will not sort of set its face against it. And the thing I would say about that, Tim, is, it's difficult, and it has been difficult, obviously, in terms of our discussions with the government. But I see no party politics here. And if it becomes an issue of party politics, that one side has called for it and another hasn't, and therefore they can't do it, we're going to get ourselves into a really bad place as a country. I certainly wouldn't in any way see any politics if the government decided, in my view, to open their minds properly to a circuit break. And that isn't a sign of weakness. To me, that would be a sign of strength. We're in a fast-moving situation. Nobody can predict entirely what's going to happen with the cases or with hospital capacity. We all have to be honest about that. You can't sort of have party politics as normal through this. And there's no point accusing people of U-turns, because sometimes people will have to change the position that they've taken. So, you know, I will certainly be putting it in the government to that way. I don't want to prolong any disagreement with them. I still don't believe they've funded us properly for the closure of parts of our economy. I've made my views clear about that, but equally we need to work with the government coming through this challenging period. So, you know, that's the way I'll be approaching it. Look at the evidence as I presented today. It's not Greater Manchester and the north of England on its own now that has the biggest growth in cases. In fact, the North East and Liverpool City region are beginning to see a slight change. You know, the growth is elsewhere, and I think the government can't use a line that says we're not going to have a national lockdown because there are some areas with lower numbers of cases. That was true in the early part of this year where we had lower numbers of cases than London and the South, but we still had a national lockdown. We can't have double standards here. We can't have a national lockdown when it's London and the South that have the highest number of cases, but a regional lockdown when it's the North that has the highest number of cases. Things have to work both ways here. Joshi, in terms of your question, I wouldn't want to claim, you know, a great deal of necessary credit here. I think colleagues in the Greater Manchester NHS are working really hard to manage things, particularly within our care homes, and continue to protect people most at risk. And I think the hospital admissions do reflect some success there in terms of, as you say, less than 10 a day. But I would point you to that figure of inpatient diagnoses of COVID-19, because it is a much higher figure than the straight admissions. So this is people, as I said before, going into hospital with COVID, but as yet untested, or people who acquire it within hospital, and that figure is, I think, higher than we would want it to be. So it is still much lower, as you say, than the prediction, but you know, we've got work to do, obviously, to bring those figures down.
I'll just ask this final question to Bev before we move into the GMSF section.
Ross, there was a question from Jen Williams about bed every night, but should we pick that up in the GMSF and housing section?
I think so, yeah.
Yeah.
Charlotte at the Manchester Evening News asks, Bev, does the fire service have concerns about increased numbers of people having home fireworks rather than going to normal organised events which have been cancelled because of COVID? Is extra capacity being prepared for bonfire night and the following weekend?
Thank you, Charlotte. Yes, we do have concerns because unfortunately there are accidents and injuries every bonfire night somewhere in Greater Manchester. So, you know, the fact that people can't go to organised events, which are generally much safer, is of concern. What we've done about that is intensify the messaging that we're doing, both through the mainstream media, but also particularly on social media about the dangers, helping people to think about how they can take extra care. And actually the extra capacity, it's not just the fire service, they will be on alert on bonfire night and through the following days, because we go through a weekend, as you say. Also the ambulance service and the police all prepare for eventualities to occur of one sort or another that day. So yes, they'll all be on alert on bonfire night and through that weekend to be able to respond effectively to whatever need there is.
Thanks very much, Bev. And if you're happy, we can bring this section to a close and move to the GMSF. Just one last. Thanks. Thanks, Bev. Waiting for the live box to return. Yes, I think so, Ross. I think we've covered everyone's questions there, haven't we? I mean, I would just ask colleagues. Obviously, there's been mention of leaked reports today. What we've tried to do is give you the facts and give you the evidence of the contingency plans. So, you know, I do think it's important. Obviously, there are scenarios that experts put forward, but I think, you know, given where we are, I think it's really important to stick to the factual position that we've got, and we've given you that today. We're obviously going to face a difficult fortnight coming up, but the feeling is that the next fortnight is going to be the most challenging, and we would expect the pressure to begin to ease beyond that. But Ross, I'll probably leave it there then for the health side of things and the enforcement side of things, and we'll have a change of subject, which I'm sure we could all do with once in a while. So
Should we bring in Paul and Elise? I don't know if they're both with us. So we've got the City Mayor of Salford, Paul Dennett, who's joined us just now, and Councillor Elise Wilson, who's our portfolio lead on economy and business. If I could just say something briefly before introducing Paul to present the latest Greater Manchester Spatial Framework to you. Of course, this is a long-running story, but actually it's a story that's beginning to come to a conclusion. I'm very pleased to say that the 10 leaders of Greater Manchester, working with myself and the Deputy Mayor, all of us unanimously endorsed this latest draft for consultation with our communities. And the key point I would want to get over at the start is, before introducing Paul, is consultation is what it says. It is meaningful listening to our communities. I think sometimes people have a feeling about consultations that it's all for show and it's just to tick the box, but actually there's no listening done and there's no change made. Well, I think we can say since the first GMSF in 2016 through the second iteration in 2019 to today's draft plan, we really have taken great care to listen to people. There was a substantial change between 2016 and 2019, and there's been a further change today in the plan that is being put before you and is now going on to our councils and on to public consultation for the last time. So there's still a further chance to comment. The headline is that the Greenbelt take now has dropped by 60%, 60% on the 2016 plan. And I can point to significant changes in this latest draft in a good number of our boroughs. So in Wigan, a site south of Pennington in my former constituency of Lee has been removed. Wigan Council listening there to local concerns. If we look in Bury, people in Simister certainly had been in contact with me, many people living there who I thought legitimately expressed concerns about the scale of development, which would have altered the character of Simister village. Well, Bury Council clearly have responded to those concerns, and you can see that now in the new redrawn plan. Similarly, in Oldham, where there were a number of concerns, leader of the council, Sean Fielding, who's worked with us on a Mills strategy and an approach to brownfield first, which very much Paul will talk about in a minute, has enabled Oldham to make a substantial change to their plan. There are changes in Stockport, the Bredbury industrial site, but of course the Mayoral Development Corporation there is our prime example of a focus on towns and brownfield first, and Elise might say a little more about that. And then if we also look at Salford, I think Paul will be able to say some changes there as well. Overall, this is a plan that benefits everyone in Greater Manchester. People will say, well, why now in the position that we're in with the uncertainty that we face? Well, I'm absolutely clear that Greater Manchester needs to emerge from this crisis with clarity about where we're going, and the work we've been doing over recent years to get this plan to this point, I think, is about to pay dividends because it gives us a clear direction. It makes the sites clear that we want to develop, to bring forward quality jobs. But actually, by having a plan, we better protect the green belt that we have. The worst of all worlds would be to go forward without any plan, allowing developers to cherry pick across the sites, to have uncoordinated development, not linked to infrastructure. That's the worst of all worlds for Greater Manchester. So in summary, what I'm saying today is we have listened, we have gone much further to protect the green belt, but we also have a plan now to put Greater Manchester in a strong place as we go into the recovery from COVID-19. And rather than now than feeling defensive about this plan, always seeing this GMSF as a negative, I think what you will increasingly hear from us is that we are confident in the plan that we're putting forward. We are prepared to go out again and listen to our communities to see if it could be improved further still. But we are now all determined to ensure that we have this plan to protect Greater Manchester's interests in the period we're about to go into. And with that, I'm going to now hand over to the City Mayor of Salford, who's done so much work to bring us to this point, Councillor Mayor Paul Dennett. Paul.
Thank you very much, Mayor Burnham. And as you've rightly highlighted, today at AGMA Exec, we got cross-party unanimous support for Greater Manchester's plan for jobs, homes and the environment. And this comes at a time when, you know, government nationally also see development and regeneration as a critical part of recovery and mitigation from the economic consequences of COVID-19. Colleagues may remember the Prime Minister's Build, Build, Build announcement, and their kind of reaffirming of their commitment to building 300,000 homes per year by the mid-2020s. Government have also been clear with us that COVID-19 is no reason not to progress the spatial plan and local plans within the district. But the reason why, you know, we're positive about this is because this plan is critical for the future of Greater Manchester. It's critical to tackling the housing and homelessness crisis we face. You know, circa 4,000 people currently live in temporary accommodation in Greater Manchester. You know, nearly 100,000 households sit on our housing waiting list, and in September we counted 106 people sleeping rough on our streets. So this plan speaks to tackling the housing crisis and pledges to deliver 50,000 affordable homes over the period of the plan. 30,000 of those are for social and affordable rent. But also the economic challenges we face as a consequence of COVID-19. You know, we're acutely aware that 408,000 people have had to rely on furlough arrangements in Greater Manchester. Obviously, at the end of this month, we move to a new scheme, but you know, people are really struggling within Greater Manchester, and having a strategic vision for our future is more important now than it's ever been. So for us, this is an essential building block for our recovery from COVID-19. It's also critical to continuing to lobby and influence government in the interests of the people of Greater Manchester, critical to accessing investment in infrastructure, critical to also providing confidence and certainty in Greater Manchester's future, whilst also guiding development in the places we want to see development and attracting investment. It doesn't stand on its own, of course. It sits alongside the industrial strategy, the housing strategy, our 5-year environmental plan and the Transport 2040 delivery plan. And importantly, as Mayor Burnham has said, this is our best attempt and endeavours over a long period of time to properly protect Greater Manchester's green belt from chaotic, unplanned and potentially costly development if we have to go through planning by appeal. But it also delivers our housing target, which has been set by government for Greater Manchester, 10,534 per year, just under 180,000 over the period of the plan. Importantly, the net loss has already been highlighted to Greenbelt from the 2016 consultation is just over a 60% reduction, and that's been achieved by removing sites and reducing those sites in terms of their size. So overall, Greenbelt would reduce in Greater Manchester by 3.25%. So we do need to build on Greenbelt for housing and our economic needs for the future. But the alternative would be a chaotic and unplanned system that would lead to the real loss of really valuable land in Greater Manchester if we didn't have this plan in place. But importantly, the plan will support more active transport, cycling and walking, town centre regeneration, deliver the continued growth in jobs and housing at the core of the conurbation. You know, 40% of our housing supply will actually happen at the core of the conurbation. It'll boost the competitiveness of northern districts, sustain the competitiveness of southern districts, and also strategically position ourselves, I believe, to capitalise on the government's suggested agenda around levelling up and rebalancing the economy. It'll help deliver carbon neutrality by 2038, net zero carbon homes from 2028, and importantly for us, it also allows us to pursue our brownfield preference policy. 88% of land supply for housing is in urban areas within Greater Manchester, And obviously the 81.1 million of government support we've received over the next 5 years will help us mobilise that. I'd just like to end on thanking the people of Greater Manchester for participating in all of the consultations to date. This was agreed back in 2014, consulted on in 2016, and then consulted again in 2019. We're now at the publication stage, and there'll be further consultation, formal consultation, between the 1st of December 2020 and the 26th of January 2021. So, you know, hopefully what we can demonstrate today is we've listened to people's feedback, and we've, you know, tried to strategically plan in the interests of everyone in Greater Manchester. And also just to ask you to engage with the consultation moving forward, because there is still more to be done. You know, ultimately this is Greater Manchester's plan for jobs and the houses and the environment for the future. It's the only plan. It's about being in control of our future to the best of our ability. And I genuinely believe this will serve Greater Manchester's interests into the future at a time when nationally and globally things seem so uncertain. It kind of reaffirms the absolute necessity to make progress with our spatial plan. So thank you, Mayor Burnham.
Thank you. Thank you very much indeed, Mayor Dennett. A fantastic job that you've done. As we a long road to this point, but I think we've hit a point where we can have, as I say, a great deal of confidence in this plan, and that is largely down to the work that you have done with officers. I think it's important to stress, as you were touching on, that this is a plan for a green recovery in Greater Manchester. The date of 2038 for a zero carbon Greater Manchester runs through this plan like through a stick of rock. And the plan, of course, sets that interim date of 2028 for zero carbon development. So this plan actually is critical to kickstarting a green recovery from COVID-19. And bring those high quality jobs of the future. So with that in mind, I'm going to pass now to our portfolio lead for economy and business in Greater Manchester, Councillor Elise Wilson, who will say a little more about the critical importance of this plan to Greater Manchester's economy and industrial ambitions going forward, but also perhaps also to touch on that town centres point, with Stockport being, I would say, the prime example around the country of how a town outside of a city centre can put forward the most ambitious plans for town centre regeneration and the building of thousands of homes connected to quality public transport links. So that is down to Elise, who deserves great credit for spearheading the Stockport Mayoral Development Corporation, but is also, of course, doing so much to chart a new course for industry and the economy in Greater Manchester. So Elise, over to you.
Thanks, Andy. Yeah, so as leaders across Greater Manchester, I think we've been absolutely committed to delivering for the well-being of the people of Greater Manchester, and part of that is about livelihoods, isn't it? It's about people's jobs and how they earn a living, and we needed to make sure, and we need to make sure going forward, that we continue to see improvements in the foundations of our economy, but also build on its unique strengths and its opportunities, and we did that through a piece of work, the local industrial strategy, and that sets our aspiration to doing just that, but it in the new areas of the economy where new jobs are going to be created, like green, clean growth, like in digital, like in advanced materials and health innovation. And so it's important that the GMSF is successful to ensure that when we're creating these jobs, we're creating them in the communities across the city region and close to where people live. And that is exactly what's set out in the Greater Manchester Spatial Framework. Now, we also know that Greater Manchester is not realising its full potential. There are disparities across the city region, and overall productivity is lower than where it should be. We know that parts of Greater Manchester, as City Med has said already, it's about boosting certain parts and about maintaining competitiveness in other parts. So we want to really set that out, and that's set out fully within the Greater Manchester Spatial Framework. And we know that having productivity not where it should be holds back wage growth and makes us more vulnerable that come along. And we also want to make sure that we realise the possibilities of our key assets, certainly, for example, around our research base, and part of that is about how we create an innovation ecosystem, connecting investment into research and development with businesses in areas across the city region, creating not just manufacturing but also innovation parks and districts, and building on innovation space in town centres and towns across Greater Manchester. And part of making sure that we do that is, as Paul said earlier, that improved transport, the good homes, precious green space and skills development that helps us make sure that we can deliver on those things. And as Andy's so eloquently put for us, you know, Stockport particularly, I think, is really pushing at that and really remains ambitious around ensuring that town centre living, and we really make the best of that and the most of that in terms of not just having the homes but also having town centres that are now vibrant, where places people want to go and places people want to be. And in Stockport, we've set a real high aspiration around that, not just delivering the newest, coolest, greenest urban neighbourhood, but also commitments around our transport to seek further investment to deliver even better public and sustainable transport solutions, delivering more green space in our town centres, continuing to build on that £1 billion investment we've seen in our town centre. And all of this is a real concrete example of how through the Greater Manchester Spatial Framework and all the work that we're doing, we're taking a brownfield first approach, and how important it is that if we're really serious about delivering on that brownfield first approach, it is a collective piece of work. The MDC and the Mayoral Development Corporation, as it says in its name, is something that Stockport has done not on its own. It has done together with Andy Burnham, with our mayor. It's done together with the combined authority. It's done together with government and through arms of the government, through Homes England, and it's that collective teamwork that has shown that actually this is how we set a blueprint for regeneration of our town centres. This is how we deliver brownfield first. This is how we continue to make sure that we put the people of Greater Manchester first and deliver on the things that are important to them and their priorities. And it is done through collective work. And I think that's really important, because that's exactly what the Greater Manchester Spatial Framework is. It's a bold, ambitious, evidence-based, albeit complex piece of work, but one that I stand by as a real testament to what we can achieve when we can work together. So I think I'll leave it there for now, Andy. Thank you.
You're on mute, Andy. Sorry, Andy. I think you're on mute.
Thanks a lot, Ross. I just was saying, Elise, that's that last point you made really captures where we are now, isn't it? The confidence that we feel in this plan, and actually the importance of having that confidence and clarity as we emerge from this crisis. We think it puts Greater Manchester in a really strong position, and we're looking now for that broad support for the plan, as well as listening to any further changes we might make. So, Ross, should we go to you now to take us through colleagues' questions?
Absolutely. So I'm going to take two questions together. The first one from Nick Statham, and I'll put them to Elise first, and then if Paul and Andy yourself want to come in, after that. First question is, Nick Statham at the MEN. All the opposition parties in Stockport have said they will vote against the new GMSF plan. This would mean that it would not pass in Stockport. How worried are you about this, and what would it mean for the other 9 boroughs? Would it kill the project entirely, or could there still be some sort of form of GMSF without all 10 boroughs on board, and how would this work? Similarly, from Kevin Fitzpatrick at Radio Manchester, Elise, how can you get this plan passed in Stockport when both the Lib Dems and Conservatives currently say they're against it? And then Andy, what happens if it's refused in Stockport? How damaging would that be to your credibility as mayor? And are you considering asking the government to allow 9 boroughs to go without Stockport? So Elise, if you want to take that first, we'll go to Andy and then Paul.
Yeah, absolutely. So thank you very much, Nick and Kevin, for your questions. I think you're slightly jumping ahead of where we are at the minute. I think Stockport Council recently, there was a motion submitted around pulling out of the Greater Manchester Spatial Framework, and it was quite clear from that debate in the full council that actually what we want to do is make sure we make an informed decision. And I am particularly proud of how cross-party we've worked to making sure that we understand the Greater Manchester Spatial Framework, that we've engaged in that process, and members across the chamber have been really enthusiastic and energetic in that, and I really thank them for it. I'd say there is a minority that has decided, you know, ahead of the game that they weren't interested, and that's a shame, really. And I'd say, you know, we should be making informed decisions. We have a duty to make informed decisions, just to fully understand what it is that we're being asked to decide upon. This is not straightforward and easy. It is a complex piece of work that many people have been putting an awful lot of time and energy into making happen, and the people of Stockport and the people of Greater Manchester as a whole need us and require us, and quite rightly should hold us to account to ensuring that we do make those informed decisions. I would still say that you know, we are continuing to do that, and I believe that as we consider this next iteration of the Greater Manchester Spatial Framework, and the members in my council chamber are considering those, that we will there's a full governance process in place to make sure that people can make those informed decision when the time comes. As to what happens in the future, I don't know, and I don't have a crystal ball, and I can't tell you what is going to happen in the future, but I do think that it is absolutely imperative that we make every single effort to really understand what we're trying to achieve here, and the importance of what we're doing. I think Paul Dennett made it quite clear earlier that there is an expectation for Greater Manchester around housing need, and that expectation on housing need includes Stockport, and you know, we are going to have to address these issues one way or another, and the balance that we have struck with this latest iteration of the spatial framework for jobs, homes and protecting the environment, because it is a balance between those are all three really important things, is the right thing, and we have that right balance. And I think it is now important that we move to that next stage, that we involve the government in this, that gets submitted not just for public consultation, but that everything then gets sent to the Secretary of State so that we can get their input on it. Because like I said earlier, this is about how we work collectively, and how we can work cross-party to make things happen. But yeah, I would say I think we need to take one thing at a time, and we need to do what we need to do right now first. Thank you.
Thanks, Elise. Andy, I'll bring you in on the points addressed to you, but also the wider question.
Thanks, Ross. So I'll pick up Kevin's question. He was asking me what does it mean for my credibility if opposition parties in Stockport vote it down. I think it would say more about their credibility, Kevin, than mine, because they would have to be honest with people about what that would mean. Stockport is, I would say, one of, if not the major beneficiary of GMSF, both in terms of the infrastructure investment that it would bring, but also in terms of house numbers, because obviously the logic of GMSF means that you can build the homes we need across the whole city region, and each borough doesn't have to build. They're in need on their own, and the effect of Stockport sort of breaking away would mean that they would have to build more homes, not fewer homes. And so those political parties would have to have a credible argument to the people of Stockport as to how they could do that while building on less greenbelt than is identified in the Greater Manchester Spatial Framework. They wouldn't be able to do that. So the credibility question, I think, falls back more on them than it does you are damaging the plans that we're developing for Stockport with regard to significant investment in infrastructure. And if you rip it up, you are basically committing to building more homes, not fewer homes. So, those are the issues that are at stake here. But as I say, let's not go down that party political path. Let's talk about this plan and improving this plan, because I think in the end that will be the best thing for Stockport. I think, Ross, I'll let Paul answer the question about our options if one borough did decide to break away, which we genuinely hope will not happen.
Thanks. We'll go across to Paul. Paul, you're on mute.
Yeah, no, thanks, Mayor Burnham. Sorry about that. I'm going to respond to all the questions, actually. The first one on Stockport, I think it's really important we look at the numbers on this. So at the moment, using the government's national methodology for calculating local housing need, Stockport will need to deliver 18,343 homes. Under the GMSF, up until 2037, we're calculating Stockport's total to be 13,481. That's 4,862 less homes than they're required to deliver under the government's national methodology. So Stockport are actually significant beneficiaries of the spatial framework. So if opposition parties take the decision to vote this down, then all I can say is they'll have to deliver significantly more housing in Stockport, which will then trigger the release of even more greenbelt within Stockport to meet their local housing need. There's a lot of talk about duty to cooperate as being some sort of panacea, and I just want to kind of nip this one in the bud, because duty to cooperate doesn't mean you have a legal requirement to meet another local authority's housing need. So Stockport can have a conversation and cooperate with an adjacent local authority, but nothing can come of those cooperations if that local authority doesn't want to build houses for Stockport. At the end of the day, what we're doing through the GMSF is exactly that. We're cooperating across the 10 local authorities. We're taking advantage of the urban density in the core of the city region, and that's actually helping us reduce greenbelt take across the 10 local authorities. So, as far as I'm concerned, if opposition parties are seriously considering voting against this in Stockport, it would be a huge catastrophe potentially for Stockport further down the road when they have to meet their own local housing need. And I say that having had a look at the government's consultation on planning for the future, and government have muted the idea that local authorities' local housing need will be binding. So quite what that means for duty to cooperate and the potential to have a conversation with another local authority to meet your housing needs sounds pretty slim, shall we say, to say the least. Obviously this is consultation, so we don't know what's going to come out of that. Obviously, if one local authority or more decides not to support Greater Manchester's plan for jobs, homes and the environment, there are options to take this forward in different ways. But I have to say, this plan is for the whole of Greater Manchester, and we've cooperated in the interests of the people of Greater Manchester. We've already said earlier on that this is all about avoiding planning by appeal. This is all about us benefiting from the urban core of the city region in terms of delivering local housing needs. So I sincerely hope that everyone across Greater Manchester actually considers the benefits that would be accrued from participating in this strategic plan for Greater Manchester. But for me, on the Stockport issue, I have to say the numbers speak for themselves. It would be a monumental risk for that district to not engage with the Greater Manchester Spatial Framework. Thanks, colleagues.
Thanks, Paul. I'm going to put a question from David Collins at the Sunday Times to you in the first instance, if that's okay, and then others might want to come in. David asks, will the spatial plan mean that developers will find it easier to factor in affordable into their large-scale developments? Should the plans without affordable housing or any Section 106 payments be allowed to be passed given the housing crisis in Greater Manchester?
So this is a really good question, and obviously as part of the spatial framework, we're committing ourselves here to building 50,000 affordable homes over the period of the plan, so between now, if you like, and 2037. However, the issue of affordable housing goes to the heart of the government's national planning policy framework, and I'm sure colleagues will be familiar with the changes that took place back in 2012, where developer profit is prioritised, land profit in terms of the sale of land is prioritised before we even enter into conversations around viability and contributions to community infrastructure levies and Section 106 payments, and obviously affordable housing contributions. Greater Manchester, as I'm sure colleagues will appreciate, has very different land values and property values to places like London and the South East, which obviously makes the viability equation when development is brought forward very different here in Greater Manchester. But if we're serious about affordable housing through the development process, then what we're going to have to do, in my opinion, is actually reform the national planning policy framework, because at the moment there's no mechanism within the framework to capture land value. So, landowners walk away with significant profit when development is brought forward, planning permission is granted, and actually that then plays out in the viability appraisal for calculating contributions to affordable housing. But as the national planning policy framework stands at the moment, financial viability, i.e. profit for developers and landowners, is prioritised over contributions to affordable housing and Section 106 and community infrastructure levy payments. So if we're serious about this, we've got to reform the national planning policy framework, which again is something we should be campaigning and lobbying for with national government. Thanks.
Thanks. I'll bring Elise in on David Collins' question.
Thank you. I think certainly I'd say for Stockport particularly, there's parts of Stockport that are particularly expensive places to buy a home, and we are currently not delivering to, we do not have a 5-year housing land supply. So it is a really big challenge for people in Stockport around affordable housing, as it is across Greater Manchester. And so enabling the building of affordable homes and making sure that that's a priority is a real plus for the Greater Manchester Spatial Framework. That we have that embedded as part of it is absolutely crucial, and I think we want to see, and certainly see in parts of Stockport, some of our most expensive neighbourhoods in Stockport have got allocations in there now where the proportion of affordable homes is quite substantial, and I think that's a really good thing, to see that people are able to actually have access to getting a home. I mean, it's basic, isn't it, having a roof over your head, and that's what's so important about the spatial framework is it's delivering on those basic needs of people, of a home, a job, and protecting the green space around them. And I think we can't lose sight of that. And it comes back to, again, the questions that were put earlier. If to not support this into the next phase, to not go to decide that actually this isn't something we want to consult on, this isn't something we want to send to the Secretary of State to get their views on it, is really really short-sighted and a real disservice to people. And if it's not this, then what is being proposed as an alternative? And to not propose an alternative and to simply say this isn't right, we don't like it, without having something else is a real disservice, especially when we consider the priority that we've placed on ensuring that we do have affordable homes, and we're making sure that homes are available to people who really need them. Thank you.
Thanks, Elise. I'm going to take a question from Jen Williams for Andy. Manchester Council's budget proposals, which came out yesterday, they include cutting £500,000 from a bed every night. Were you aware of this, and will the scheme be able to cope if that money is cut? Do you think that the council should be cutting from homelessness services as part of its savings, when by its own admission this will probably cost them more going forward and create more rough sleeping?
Thanks, Jen. So yes, I am aware of it, and it's a reflection of the position, the invidious position that councils find themselves in such a dire financial position. Just to give you some current statistics, which haven't been put out there for a while, there are currently 480 people in a bed every night accommodation in Greater Manchester, and that's alongside 400 to 500 people still in what we call everyone in accommodation. So if you look at that level of provision, it's pretty huge, really, and essential, I would say. Now, bed every night has grown from a sort of as you know, a sort of an early project into something now that is providing substantial support to people across the 10 boroughs, and it's funded in a complex way with contributions from a number of places. But we've been very grateful to Manchester City Council for the support that they've given, but of course it also brings benefits for them. But I think what this brings out is the impossible choices that councils will be asked to make if the financial position remains as it is. The real harm will be caused to people. So what we would say to the government is, if everything you've said around everyone in and being serious about rough sleeping is to have meaning, then they have to do more to help councils at this particular moment in time. You know, we could not countenance really a major loss of bed every night, because we know what that will mean, and we've seen it before on the streets of Manchester, and we don't want to go back there. So, you know, the scheme has come a long way in a short period of time. I will do anything, as you know, given it is my top personal priority, to support a bed every night. It is providing a crucial service to a lot of people. You know, there are a number of options that we can look at, but we have to recognise the position that our councils find ourselves in, and that you, perhaps more than anybody, has written about. It isn't a sustainable position. Impossible choices are being faced by Paul, Elise, Richard, and everybody running councils at this moment in time. And if we don't recognise that, then more and more choices like this are going to force to be made in the coming weeks. And you know, that fills me with absolute fear for where we will end up coming out of this pandemic.
Thanks. I think we've got time for just one more question. Kevin Fitzpatrick and Adam Clark have both just come back to say, if Stockport rejects the plan, can the rest of Greater Manchester go on without them?
I think that's for Paul, really, Ross.
Yep, put that to Paul.
Yeah, thanks very much, Ross. The rest of Greater Manchester can pursue a plan of the 9, but however, the numbers will inevitably change, and therefore we will need to revisit allocations across Greater Manchester to ensure we're doing everything we're saying we're doing in the plan, and also meeting our local housing need as determined by central government. And obviously what that would trigger probably is a further delay to the preparatory work required, really, for coming up with a plan of the 9 local authorities of Greater Manchester. What I would say, though, is I'm hopeful that, you know, Stockport will realise that they are one of the prime beneficiaries of this plan, and as I've already highlighted, as a consequence of their engagement with this, they'll be able to deliver 4,862 houses less, therefore protecting more green belt as being a part of the Greater Manchester plan for jobs, homes and the environment. So I sincerely hope we don't get to that position, but yes, we can pursue a plan of the 9 if obviously leaders in the 9 other districts agree to pursuing that course of action.
Thanks, Paul. I'm just going to go to Elise and then Andy for final comments, given that we're just about run out of time.
Thanks, Ross. I'd just say that if Stockport Stockport so far, members across my council chamber have really engaged in this process. We've seen from different parties, people really putting a lot of energy into making sure that this is shaped right for Stockport. So I do think we need to remember that when we're talking about Stockport, that there's been an awful lot of work going into this, and I think there are members that clearly understand the benefit of the spatial framework to the people of Stockport. That said, if Stockport, or any borough, I think, but if Stockport doesn't want or decides that it's not going to continue to participate in that, it will mean Stockport will have to come up with another plan. It will have to do something else, and I think that's what Paul's saying, is that we've got, you know, just shy of 5,000 homes that currently are not having to be delivered within the borough. We will have to find another alternative. That's a significant amount of work, and will require significant resources on the council at a time when resources are very scarce, and we have seen real difficulties with council's budgets on how we actually finance things going forward. And so, coupled at a time when there is significant change being planned with planning, the government's made that quite clear and has been made a significant commitment of shaking up the planning system, along with this crisis that we're currently in, the economy in real uncertainty and real financial constraints on council's budgets, to not go ahead and then to have to, with the spatial framework, but to have to go it alone, is going to be a significant pressure for Stockport, and really bring into question bring into question other parties' commitments around their brownfield first ambitions, because the government has, and I've welcomed this, you know, made money available to Greater Manchester to deliver brownfield sites, and Stockport has been a beneficiary of that and continues to be a beneficiary of that through the Mayoral Development Corporation. But overall, we have over 40 sites being bidded for brownfield money that government's made available across the entire borough. If we don't have a plan, we bring into serious question our ability to be able to access that money. And if we're not accessing that money, then how can anybody stand up and say they're trying to protect the environment, they're trying to protect our green spaces, they're developing and pushing for a brownfield first approach, when they're really bringing that into question and jeopardising our ability to be able to do just that? Thank you, Andy.
No, thanks to you, Elise, and thanks to you, Paul, for your strong, confident, clear answers today. I think it's much appreciated. And I just will finish off by saying to Kevin and Adam, I mean, I think you've heard from Paul, you can go ahead as 9, but it's a complex jigsaw, I think, as Elise said before, and you can't just necessarily just take one piece out and it all just carries on. Of course, there are knock-on impacts on the rest of the plan if one was to pull away. It would certainly delay significantly the rest of the plan, and it would lead to a lot of extra cost. So I guess just finishing where Elise left off, you know, let's not make this an issue of party politics. If there are members in Stockport who have concerns about this current draft, come and talk to me or Elise about how we make it, you know, better. What else could be done to make it better? Simply ripping it up is putting politics before the place in which you live, because I am confident in saying Stockport is one of the major beneficiaries of the Greater Manchester spatial framework, both in terms of reduced house building, but also the infrastructure that's coming with the other sites that have been allocated, including the Mayoral Development Corporation. So, as I say, work with us on this one. I'm pretty confident that we've got 9 boroughs ready to support this scheme. I hope we can add Stockport to that list. Let's put this behind us, and then Greater Manchester can kind of move forward confidently into 2021 and get ready for recovery. That's where we want to be. That's what we think we've done by putting this revised plan forward today. It's always going to be a compromise. Let's everyone be clear about that. Nobody can get everything they want from any plan of this kind. Everybody has to compromise. So let's show Greater Manchester at his best. Have one last go at a conversation around this plan, but let's everybody stick with this process, agree it, and then we'll move forward confidently in the new year. So thanks everybody for your questions today. We've thrown a lot of stuff at you there over the last hour and a half, but I hope you found some of that useful. So thank you for tuning in as ever, and for everything you do to provide that information to your listeners and readers. Thanks, Ross and the team, and we will see you all again next week. Have a good weekend, everyone.